with us today, we have Assembly Member John McDonald. He's the Assembly Member. He's in his 5th term for the New York State Assembly. He represents the 108th Assembly District, which consists of parts of Albany, Rensselaer, and Saratoga counties, including his hometown of Cohoes, where he served as mayor for 13 years. He is the chair of the Oversight, Analysis, and Investigations Committee, and he sits on a number of key committees affecting our industry, including health and insurance. Next, in addition, if you don't know, he is a practicing pharmacist and president of Mara's Pharmacy. Next, we've got Ashley Ranslow, New York State Director for NYHPA, which represents more than 11,000 small independent businesses statewide. She's responsible for legislative and political affairs for NYHPA. Next, we've got Becca Telzak, Deputy Director of Make the Road New York. She's been with the organization since 2009, building its health department to serve over 8,000 community members through a broad range of different programs. She's also led the Make the Roads advocacy efforts. And then finally, we have Josh Terry, another mass transplant like myself, Legislative Director for the Civil Service Employees Association. And he's been with CSEA since 2007 in a variety of different roles. So, Do we have my? If we could just turn my lapel mic on, that would be great.
All right. We on? Okay, great. So I've said this a number of times. I love all of our sessions. I love all our panel discussions. But the one that I always look forward to the most for our annual conference is this view from the marketplace, because it gives us an opportunity as health plans and as our industry to hear from really the key stakeholders that we work with, represent, and deal with on a regular basis. So we've got folks representing consumers, providers, businesses, unions. So this is, for me, has always been one of the highlights of our conference. So I'm going to start, sort of take us back through the day and get the perspectives from our panelists on the different issues we covered, starting with the 2022 elections, and would love to get sort of a perspective of both nationally and at the state level. So nationally, and there's been a lot of fluidity in the last really 2 hours. The Democrats have held the Senate. Last night we found out Republicans took a very thin majority in the House. There's still a handful of seats to be counted. And then earlier today, former Speaker Nancy Pelosi announced that she wouldn't run for Minority Leader. Hakeem Jeffries is going to become the new leader. For each of you, give me just some perspective what this, what the outlook in Washington means for the constituencies that each of you serves, and in addition to that, what would you like to see, what issues, and it doesn't necessarily have to be healthcare, but what issues would you like to see Congress tackle as we head into 2023? And Becca, I'll start with you.
Great. Hi, everyone. I'm Becca with Make the Road New York. So just quick background, Make the Road is a community-based organization. We work predominantly with low-income immigrants and working-class communities across New York State. I think for us, the election, it wasn't everything we wanted, but it was also not as horrible as we were anticipating. I think we predominantly work, again, with immigrant communities. So I think for us, the biggest thing we want to see come out of the lame duck session and immediately is some sort of immigration reform. I know that, may not seem like it's connected to healthcare in a way, but it is. Lots of folks who we work with are undocumented or have some sort of temporary status, DACA, Deferred Action for Childhood Arrivals, or temporary protected status, and aren't able to necessarily access healthcare or other key benefits due to their immigration status. And so at the federal level, we really want to see some sort of immigration reform that leads to a path to citizenship for all immigrants that allows them to be covered by the safety net and then have access to all of the key services. The other key thing for immigrant communities, I would say, in terms of healthcare at the federal level is to make sure that in the next Congress, we work on expanding the Affordable Care Act to include undocumented immigrants who were explicitly left out back when Obamacare happened originally, and now it's time to really make sure federally we are including undocumented immigrants across the board. So I think we're hoping that in this next, both in the lame duck session and then moving forward, we're able to move forward with some of these key immigration relief efforts.
And before, Becca, just out of curiosity, the challenges that you're seeing with migrants being sent up from other states, what kind of pressures is that creating organizations like yours down in the city?
Yeah, I mean, we've been in the forefront responding and working closely. We, in New York City, for example, obviously there's been many, many buses of thousands of migrants coming every day since the beginning of August. And so we've been we started at Port Authority, greeting the migrants as they came, providing them key services, access information on key services, providing them cell phones, since many of them actually did not have a phone or lost it while crossing the river or crossing the border, whatever way they came. And so we were providing them with key services, phones, to be able to connect to their loved ones and family members. And so we've been making sure we welcome them into our communities, invite them in, connect them to whatever resources are available, help them find housing and other key critical services, and working closely with the city in particular to make sure that we're kind of integrating them the best way possible.
So, Assemblymember, putting on your pharmacist hat, give us some perspective as to the things you'd like to see, or you would hope to see, Congress take on either in the lame duck session or as we get into 23.
Well, I would think, first of all, the lame duck session is going to be very interesting. I think Democrats probably feel there's unfinished business, and they're going to try to get through hopefully some good policy, but we'll see. That remains to be seen. I saw a couple things introduced yesterday that were interesting. I don't know if it's disruptive or not. I'm trying to figure that out with the PACE program. At the same token, the general public in general actually kind of feels a little more comfortable when government's divided a little bit, when one house is one party, one is the other, because in concept that should force everybody to work together and work for the common good. That's in concept. Honestly, I don't know what the heck's going to happen. I got a lot of heat here in the Capital Region a couple of years ago when Biden took over and everyone was signing letters to impeach Trump. Well, last time I knew, first of all, I'm not a Trump fan by any stretch of the imagination, but the New York State Assembly doesn't do any national impeachment. So I said, let's focus on the work at hand. And it seems as if the very small majority that the Republicans will have in Congress, initially they're going to be more focused on Hunter Biden. Well, I get it, I understand it, but that doesn't really help the average person put food on the table or pay their medical bills. So, I think they need to continue to focus on, I'm a big, people know this who've dealt with me, you need transparency. The federal government, state government is all in on funding, maybe not to the degree some of the plans like, but we fund a lot of healthcare initiatives. We want to make sure that those dollars are being spent wisely, and we need to work in partnership with the plans and the providers to try to figure out how do we best deliver the most efficient services, plain and simple. I think, words of the wise, I think technology needs to be more enhanced, to be honest with you, because we have major workforce issues, major workforce challenges. I mean, Ashley can talk about it just with all the businesses she represents. I literally have spent the last 3 months just talking to hospital CEOs and plan CEOs who are actually on the same page, recognizing there's an issue because the hospitals are looking for more money, and the plans actually understand the challenges they're having, and it's all connected. I use the example of nursing homes don't have staff. Patients don't leave hospitals to go to nursing homes. People don't leave the ER to go up to the rooms. And by the way, and it was a good article this morning here in the Capital Region, the ambulances are sitting on these ramps for 2-3 hours at a time. That doesn't make me feel any comfortable if I'm having a cardiac event at home and there's no ambulance to respond. So we need to, find ways to integrate more technology. I'm a big, when I use the term community paramedicine, it just gets the nurses understandably upset. I think treatment in place is a better terminology, where we are actually having a licensed practitioner talking to patients versus a $17 an hour EMT, and kind of working through the vital statistics to say, yeah, this is not good, but you know what, you can wait a couple days and we can get an appointment for you and you can go see a provider. That takes a lot of financial stress off the system, which we all benefit from.
So our clinical directors met yesterday, and we had a great presentation from the folks on community paramedicine. I think it's certainly something that we're going to want to kick the tires on, particularly with some of the upstate institutions that are working on that. So you're right, technology has to be something that we need to leverage in a better way. Ashley, similar question from you. I mean, you're the ones that have been dealing with probably the biggest challenge throughout the pandemic, trying to keep your doors open while at the same time trying to maintain coverage for your employees. What would be some of the big priorities you'd like to see Congress tackle? And at the same time, what are some of the things that you would hope that they would be talking about? And again, not necessarily health related.
Absolutely. The constituency, for those of you who don't know, that we represent is small businesses. Average size of our members, 9 to 11 employees, so truly your small mom and pop shops that you think about. That's who NFIB represents. And for them and for so many other people, for consumers, going into this new Congress, and I echo what the Assemblyman said, hopefully it means we find some moderation and some ability to do some bipartisan work. We'll see if that plays out. But the focus has really got to be on inflation, supply chain issues, labor shortages, and the economy overall. We've all heard the warnings that we're looking at an economic recession possibly within the next 12 months. Inflation is still stubbornly high, and now we're also heading into very cold weather months here in New York, where energy prices, utility bills are scheduled to rise rapidly by as much as 40%. Small businesses are consumers like everybody else. And as their costs go up, it makes it much harder for them to not even just stay in business, but just to make payroll, to offer the benefits that they want or need to offer, to try and keep their prices contained, which obviously continues to fuel inflation. So we really need Congress to pivot to those sort of kitchen table pocketbook issues and really focus on trying to mitigate any sort of deep economic recession, try and get inflation under control, try to figure out the supply chain problems, and really help businesses get back to a better footing. Because coming out of the pandemic, small businesses especially suffered enormous losses. Many of them never recouped those losses, but have miraculously found a way to continue on, and we need to do a better job of supporting them.
Josh, a similar question for you. The major priorities that you'd like to see Congress take on for the constituents that you all serve at CSEA.
So the Republicans are going to have a very narrow majority in the House, but that majority is even narrower than we think because of the Freedom Caucus, right? I mean,
right.
To get something passed, McCarthy is going to have to do one of two things. He's going to have to cave on a lot of issues to the Freedom Caucus, which maybe that has to do with hearings on Hunter Biden or whatever they want to do, or they're going to have to reach across the aisle on things like the debt ceiling, on appropriations, in order to pass them. And so I'm not making a prediction, but I think we will see more bipartisan votes coming out of the House in the next 2 years than we have in a long time. That's not a prediction, but that's just my gut, is that I think that we're going to have to see that. In terms of what CSEA is looking for, the last 2.5 years, we've gotten record funding out of Washington, D.C. That's what kept our local governments afloat, state government, our school districts. So we started at about $17 billion, I think, last fiscal year when it was all implemented. That goes down to about $3 billion in the next 3 years. But a lot of that money has become institutionalized. Some of that has become what we are using to operate our child care programs, which CSEA represents, in our school districts. So we always talk about a soft landing for a recession, but we need to have a soft landing on this federal funding because the cliff is coming fast. And with that, especially if it's tied to a recession where we're going to have less revenue coming in to our general fund, we're going to see service cuts, we're going to see program cuts, unless we can have Congress find a way to maybe phase this money out over a longer period of time, increase it, in the interim, in order to keep those programs going. And I think that's one of the biggest things that we're really looking at, from the public sector labor point of view.
Well, earlier today we had, as part of our political conversation, there was a few comments about hopeful optimism around democracy. I hope you're right that maybe there will be some bipartisanship reaching across the aisle. Fingers crossed, but TBD. At the state level, for those folks who hadn't seen it earlier today, Robert Mujica said that he would be, leaving DOB. So it sort of brings us to back to the question of state issues, what the 2022 elections mean, and again, given, Josh, I'll let you sort of kick this off. I mean, given the potential fiscal challenges that might be coming, although earlier this week, I think we got better than expected news, but we're not even halfway through, or about halfway through the fiscal year at this point. But give us a sense as far as some of the priority issues that you're going to have for CSEA at the state level, especially when we're probably about 2 months away from the state of the state.
So, right, we're going into a year with a lot of new committee chairs in the Assembly, a lot of really important committees. Health, I think Liz Benjamin touched on this, health, insurance, environmental conservation, housing, and for us, probably our biggest committee, governmental employees, which runs through all the civil service laws that we do, pension legislation. Those are all new committees, and even if we're going to put people in as chairs who've been in the legislature for 10 years plus, there is still a lot of education that has to be done from the Health Plan Association, from us, from NYHPA. That's a lot of work. So I think we're going to see a slow rollout to start the year. I think it's going to be a bit slow. But what we're working on now, what we've been working on, is staffing in our hospitals, our nursing homes, OPWDD group homes, and our mental health facilities. We can get everybody insurance, everybody could have access to care, but if you cannot see somebody, if you do not have a physician that you can see, or a nurse, or a home care aide that can come to your house, your insurance is pretty much worthless, right? I mean, so we need to staff up. Over the last 10 years, we've seen our state workforce at our state hospitals, our OPWDD group homes just be decimated. We've lost 30% of staff there. We can't keep staff either. The turnover is so high. So how do we upgrade our titles? How do we get them more money? And I know, the state assembly, the Senate, and the governor this past year passed healthcare bonuses worth $3,000 each. That's something, but it's not a long-term solution. We need a long-term solution to recruit and then retain this staff, because a lot of these jobs pay, $16, $17 an hour to start. And if you can go make that elsewhere, that's not in a high-pressure environment like a healthcare facility, so you can go work in, retail or anywhere else, you're more likely to go take that job. So how do we keep people in this, in these jobs going forward to make sure people actually have true access to care, not just on paper?
Yeah. Actually, similar question. I mean, at the state level, give us a sense of what you're seeing as the big challenges, priorities when you're talking with folks in the Assembly or Senate.
I think the next couple of years are going to be very challenging for a variety of reasons. One, the turnover in committee chairs. We're all going to have to familiarize ourselves, introduce ourselves, educate them on the issues. But there were some interesting developments in the election in New York State. While obviously the Assembly and Senate maintained their majorities, that was never the question. We did lose some moderate senators in the state Senate. Some of the seats that Republicans picked up are from traditionally more moderate districts. So the challenge in the next couple of years, I think, for both the Senate and the Assembly is, what are the conference's priorities? Is there an immense amount of pressure from those in the conferences that lean more to the progressive left, to the Democratic Socialists? Is that what drives the agenda? And I think that's really going to be the challenge. And then now that Governor Kathy Hochul has won her first election and is now serving 4 years, does she lay out priorities that she wants to accomplish? And what are those priorities? And so those are the big questions we have going into next year. For us, and from the small business perspective, it's all very similar to New York State. New York State is a very difficult place to do business in. We have one of the worst tax climates in all of the United States. We're the 49th worst state in terms of taxes. And we have an issue with the unemployment insurance system. The state is in a massive amount of debt with terms of UI. It owes $7.7 billion to the federal government. It has to pay that back with interest. Right now, small businesses are paying the highest state UI tax rates possible to help pay down that debt. And that will continue until New York addresses that problem. And if we are looking at a recession, that puts the UI system at a further strain and just makes the problem that much worse. So our top priority going into next year is addressing the UI trust fund crisis and dealing with that debt, having New York pay it down, and providing some relief to small businesses. But then also, we need to be very careful about our taxing and spending policies going forward, because small businesses are already carrying a tremendous amount of water.
So, Assembly Member, I mean, you're in a unique position. I'll let you decide which hat you want to put on to sort of answer the question about, priorities, challenges that the state may face for the constituents that you serve.
Well, Josh and Ashley referenced it, but it really is a challenge. We have, I would say, 6 major committees that have to have chairs appointed. And traditionally, that's usually done after the speaker is confirmed, which is not to January 4th. Now, maybe we'll move it ahead this year. We'll find out. We'll be here in a couple of weeks to gather around and discuss things as a caucus. But it's, no matter who it is, as those chairs, even if they've been there for 20 years, huge learning curve. One of the bigger challenges I see as a former employer, right, is we've seen a lot of great quality people on our program and council staff, on our Ways and Means staff, who've gone on to better opportunities, and good for them. I'm happy. I don't hold it against them, but it doesn't make it easier for us because most members don't have staff trained in that committee. We have a couple people, and that's about it. And the days of the big committees are gone. Dick Gottfried left, and he had a budget of about $785,000 for his staff. The next health chair will probably have $350,000. So they're going to be kind of flying a little bit blind, no matter how smart and experienced they are going to be. That's going to be a challenge. Meanwhile, the governor is, people are moving on. And at the same token, hopefully, knowing that 4 years is the governor's term, some people will decide to come back in and give to public service, and we are able to get some good experienced folks around the table. That being said, the first-year budget for a 4-year governor is probably going to be a little bit aggravating to the legislature. I think they're going to try to push some things and priorities, which is okay. That's part of the discussion and part of the process. It'll see how it works out. As you know, the governor, irrespective of who it is, has some significant power in the budget process. So things that the legislature traditionally, maybe not me specifically, but traditionally as a body, may not like, the governor can probably push through. That may work out well for some interests. You just never know how it's going to operate. So it's going to be very interesting, and the schedule is just crazy. I mean, January 17th is when the budget's going to be released. I mean, members won't even know what office they're in, let alone, they won't even know what paint they want to put on the wall, let alone have it done and ready to go. So I think maybe we may not do as many atrocious things as we like to do by the end of June, because that's always the big fear after the budget is what are they going to do next. On the other hand, never underestimate the willingness of the legislature.
We won't ask you for any predictions on who's going to fill those committee chairs.
No, I have my inside favorites. So.
Okay, all right. Well, you're welcome to share just among friends here. Becca, similar question. I mean, obviously, we had worked with your organization, Business Council, Immigration Coalition, CSS, and the Conference of Blues around coverage expansion around the EP. Can you give us any insight as to what some of your priorities might be heading into 23?
Sure. And yesterday, just to Make the Road New York, we launched our state platform yesterday. Our top healthcare priority, similar to what it was last year, is expanding health insurance coverage to everyone, regardless of immigration status. So there are about 154,000 New Yorkers who are not eligible for insurance due to their status, which is a large number of the uninsured rate in New York, and they cannot enroll because of their status. And these are the folks who have been struggling the most throughout the pandemic, are continuing to struggle through the pandemic. They're the people who lost their jobs or were the essential workers working at the forefront getting us through the pandemic and are not eligible for coverage and have been passing away at much higher rates or having a lot of horrible health outcomes at higher rates due to not having insurance. And so our top priority there is our Coverage for All campaign, which we partnered with the Health Plan Association on last year, to expand health insurance coverage to everyone regardless of status through a state-funded essential plan, which would be providing insurance to those folks not eligible between the ages of 19 and 64, and then ensuring that they can then access something immediately to provide them some sort of coverage. So in terms of healthcare, that is our top priority. A few other things to note. I know you actually mentioned unemployment insurance. We, a few years ago, had a huge victory of winning $2.1 billion in the first ever excluded worker fund for excluded New Yorkers not eligible for unemployment insurance or pandemic relief to be able to receive some sort of relief from New York State. And so this year we are advocating for and would love to see kind of a permanent solution to that, right? So permanent inclusion in the unemployment system for all New Yorkers who have been excluded. Another thing to note is our good cause in terms of housing, our good cause eviction legislation to bring renters' rights to tenants in smaller buildings who are often left out of tenant protections. So those are, and then a few other quick things just in terms of like funding for services. We see kind of huge gaps in access to funding for key services in our communities. So making sure that we continue to fund things like the Community Health Advocate Program to help people navigate between insurance companies and providers and help provide one-on-one assistance, or for those not eligible for insurance, helping them navigate the complex system and figure out where to go to access low-cost care, and then also kind of navigator funding for community-based organizations to support the work that health plans do as well to enroll folks in coverage if they're eligible. And then we also would love to see kind of a new program to fund community-based organizations to conduct outreach with high rates of uninsured individuals to make sure that for those who are eligible and aren't enrolling, there's targeted outreach for those communities to make sure that we can increase enrollment rates there. And then lastly, in terms of service funding, we would love to see kind of an investment in more funding for adult education services, so community-based adult education services to make sure that we are providing ESOL classes, citizenship classes, workforce development programs, et cetera, to English language learners across the state.
So any other perspectives about what, what we could, what you're all thinking about for 23 or equally important from a health plan perspective, things that, our industry should be giving consideration as we start thinking about big priorities, issues to tackle in 23 before we jump into some of the other, issues that we tackled today?
The one thing I may mention, I may have referenced this earlier, and the health plans have an interest in this. These hospitals with the traveling nurses have gotten absolutely swamped. Here in the Capital Region, Albany Med, there's probably about $75, $80 million over in staffing in the red just on that one item. We, the state, have to figure out a way to plug those gaps because the reality is they're going to be pushing back on the plans for more money. And the reality is, I've been talking to some of the plans, they want to go back and revisit the whole Medicaid system because they're challenged to meet the requirements. So we've got to, and I've talked to a few CEOs of the health plans, they're actually very sensitive to the hospital's needs because the infrastructure is failing. And unfortunately, in this day and age, as much as we think everyone should have a primary care provider and everyone should be practicing preventative health, for many people, even in upstate New York, the hospital is it. That is their care provider, and that's the most costly way to provide care. So we've got to find a way to change that dynamic.
Well, I think that's a good segue to get into the conversation around healthcare costs, and certainly there's been, a lot of discussions, issues between contract negotiations between health plans and hospitals coming back looking for higher rates of reimbursement. That puts pressure on health plan premiums, which ultimately gets paid for by employers and consumers, employers unions. For each of you, give me just some perspective of earlier today, Katie Martin had presented information on healthcare costs, rising prices. How are we doing in trying to getting at healthcare costs? Ashley, I'll start with you.
Not very well, to be blunt. For our members, the healthcare situation, put inflation, supply chain, some of these global issues aside, which is, at top of mind. But typically, when we ask small businesses, what's their number one problem? It's the cost of healthcare. Over 50% of businesses will tell you that is their number one most critical business problem. And they have seen premiums go up at staggering levels over the last several years. And it's unsustainable. And unfortunately, many of them have to make very difficult choices when they don't want to have to do that, whether that's looking at the type of plans they offer, cutting back on how much they put towards an employee's premium, et cetera, et cetera. And I want to mention this first, is that small businesses really pride themselves on trying to offer high quality benefits. 29% of small businesses pay the entire portion of an employee's single coverage premium. Compared to a large corporation, it's 5%. So small businesses really do pride themselves on trying to take care of their employees and offer good benefits. But where we are right now and the way that premiums are rising, the way that healthcare costs are rising, it's really unsustainable. And the state needs to do, and the nation as a whole needs to do a much better job at addressing what are those cost drivers, trying to get those down, control them, and really control the health insurance premiums.
Ashley, are there approaches or thoughts that your members articulate that either policymakers or benefit design that that either A, they're considering, or B, approaches that the state or the marketplace needs to be moving into to get those costs, those underlying healthcare costs under control?
Yeah, I think the thing that we advocate for, two things that we advocate for the most are cost transparency, right? If you want to control costs, we need to know what things cost, and that really needs to be at the top of the list of things to get done. And the other thing is what the plans are required to cover. And especially here in New York, small businesses, they want flexibility, and they want the ability to offer plans that aren't so robust or need to be so robust. But New York has sort of pinned itself in this corner of offering, you are required to cover and offer all of these things, which drives the cost of overall up. So being able to pare that back a little bit and at least offer something to your employees, and they're not able to do that, it's sort of all or nothing. And so regaining that flexibility, having cost transparency, those are certainly top priorities.
Becca, you've been nodding your head about the cost challenges. Give us your perspective from the folks you represent, and then secondly, are there approaches that we ought to be taking to make healthcare more affordable?
Yeah, so we hear every day from our members kind of the struggle to afford healthcare. Oftentimes, our members avoid getting care because they can't afford it, right? So they're making the decision between, do I put food on the table or do I go to the hospital when I really need care, right? And are waiting to the very last minute until it's very, very urgent because they cannot afford the cost, right? So we hear these stories every day. We also hear every day of kind of folks who don't have insurance who are struggling to access hospital financial assistance, which exists and they're eligible for, or for folks who kind of are between the gaps of insurance, kind of trying to figure out how to access hospital financial assistance and are really, really struggling. And so we hear of kind of lots of people getting put in collections or even sued over medical debt, which is really horrific. And so in terms of solutions, one thing that we are advocating for is what we're calling, it's kind of revamping the hospital financial assistance law, what we're calling the Ounce of Prevention Act, which basically adopts one common financial assistance application across the state instead of having each hospital have their own individual application that people need to search through, figure out how to access. So there'll be one standard application, and then also a way to simplify income rules to ensure that low-income people are able to actually access those discounts that they're eligible for. And in general, just simplifying the process and then kind of eliminating some of the asset tests that exist and making sure that patients have more than 90 days to apply, right? Because right now you can only apply within 90 days. Sometimes it takes people 90 days to even figure out what this program is or to know how to apply, right? So making sure that there are ways to simplify it and have people be able to access those programs would really help with some of the medical debt that we see in our communities.
Josh, similar question for you. I mean, it may be, maybe a little bit of a different perspective, fully insured versus self-insured, but I mean, self-insured accounts may have, certainly have a little more flexibility in what they can do, but the underlying price issue, it puts pressure on everybody. So, give us some perspective on how your folks are feeling.
So, our union represents, we have our state executive branch members, which is about 60,000 people plus families inside NYHPA. And we represent municipalities that have 5 to 10 workers in them that are in, smaller plans that cost more. Our members are generally happy with their insurance because they get to negotiate it. They get to sit at the table and say, here's the plan we want, here's what we want to contribute, right? They have the negotiation with management. But when insurance goes up, we have a couple choices. You can just pay more, nobody wants to do that. Or, you give up a raise in order to keep it at the same level. And for years we've done that. We just got done finishing our state contract with Governor Hochul back in the summer, and we were able to secure economic gains with raises without actually contributing more to our health insurance. And one of the ways we did it was we looked at who was utilizing out-of-network providers, within the specialties, and we found it was a really small number, but they were driving a massive increase in what it costs, because the people that do not join NYHPA charge whatever they want, any amount of money, and NYHPA was paying it. And so we created incentives within our new collective bargaining agreement to incentivize people to stay in network, not go to these out-of-network providers. Now, the out-of-network providers, you may have read this, they're still getting paid a good amount of money under the new NYHPA rules. They're still getting paid 275% of the Medicare rate. But what we decided was there was no longer a blank check. And we were not going to be party to a blank check anymore to these out-of-network specialists, because if we didn't, our members would have gotten raises or they would have had to pay more in health insurance. So I think somebody earlier said, if you got to do something, right? Do anything. And when we looked at this, that was something that we could do, and it really affected a minuscule percentage of our membership on the state side. But the savings for the 96% of our members in terms of more, economic gains at the bargaining table was worth it. It was worthwhile to do.
Well, you're the steward of, steward of the healthcare dollar, and making sure that your workers are able to get, coverage is obviously critical. As Assembly member, I know you've talked a bit about, transparency. We had, robust conversations earlier today about, underlying healthcare costs, the challenge of affordability. Are there policies that the state, whether it's from a regulatory standpoint or legislative proposals that policymakers should be considering as ways to get at underlying healthcare costs, or at least to address some of the affordability challenges?
So there's a lot of different ways to get there, right? There's always the traditional about trying to scale back utilization. In the pharmacy world, I've always been amazed at how much leniency people get in order to get their prescriptions filled. If you use 70%, you can get it refilled again. Doesn't sound like a big deal. Running out over a course of a year, it's a big deal. And then, by the way, they have these auto ship programs for home delivery, which people on home delivery, that's fine, but every 90 days, something showing up your house, whether you need it or not, to me, speaks volumes of waste. In my pharmacy, I've taken back hundreds of thousands of dollars in the course of a month of drugs never used. So the problem there is the system's a little bit convoluted. There are entities who actually make a better living dispensing more medications. That's not really good for the bottom line of the healthcare system. And as you know, those who know me, I'm a big, overall, I love everyone talking about how drug costs are going up. The net cost of drugs is not going up. Drug costs are going up to the consumer. They're seeing it at the point of sale. But we know that there's a significant amount of rebates going on that nobody really knows where they're going. But we are now going to have, DFS has now got their charge. They've hiring like crazy, in the words of the superintendent. So maybe we'll get to the bottom line of this. And I know that's also something that on both sides of the aisle at the federal government, they're taking a very hard look at. And at the end of the day, I can say as one provider who's been in the middle of the war between pharma and the PBMs, let them have at it themselves, but in an open manner. Becca mentioned something earlier, and honestly, in my district, going back 2 or 3 years ago, I would have been voted out of office in a heartbeat if I said this. But in all fairness, there are a lot of individuals who are undocumented, who are showing up in our hospitals, straining our healthcare system, and those hospitals are eating that coverage. They're not refusing them by any stretch of the imagination. So there is merit to the consideration of trying to find a way to provide them coverage, just so that we can help shore up that infrastructure that I talked about earlier. I think that's something that in time, if we change our attitude nationally in regards to the fact that the undocumented are our workforce, they're our neighbors, they're our community, we actually can have a much more civil discussion. Unfortunately, it's been painted with such a prejudice over time. It's very uncomfortable. I'm only up the river, and in my community, 5 years ago, I would have gotten thrown out of office. Nowadays, they're starting to realize there's an impact, and I think we need to continue to have those discussions.
Yeah, and there are conversations that have to happen because
Yeah.
there are neighbors that are not they're also an important part of the economy, and I think a lot of that gets lost in the angry rhetoric that we've heard.
You talk to a lot of business owners. Ashley, I'm sure you hear about this. They're having a very difficult time attracting and retaining individuals.
Yeah.
I have spent the last 2 years in Arbor Hill down here, a couple nights a week or on the weekends, vaccinating for free and volunteering all these undocumented individuals who don't have connection to the healthcare system. They're workers. They want to workers. They want to work. Sometimes they're just afraid to come out of the shadows, and it's a sad position to be in. And it makes me remind myself that when my great-great-grandparents, the Italian and Irish, they dealt with the same dynamic. So I think we need to kind of get over ourselves and make it happen.
Yeah, no, you're absolutely right. There are more and more businesses, sectors, especially industries, construction, transportation, logistics, agriculture, that have always been somewhat reliant on that workforce, but are now even more reliant on that workforce because of labor shortages. And those are often the businesses that are crying the loudest for immigration reform and changes to H2A programs and whatnot.
Could I just piggyback on something here? So we know that we have undocumented immigrants here. We know they utilize health care. And people act like there's no money to treat them, but we know that there's hundreds of millions of dollars, if not billions of dollars, in the state budget every year for indigent care. But that money does not go to the right hospitals. We see hospitals, wealthy hospitals in Manhattan.
Preach, Josh.
That are getting this money, and it's not going to the hospitals that like SUNY Downstate in central Brooklyn, Nassau Medical Center, Erie, right? The ones that are the true safety net hospitals are not getting their fair share of this money.
Health and hospitals.
The ones that are actually treating these folks, HHC, right?
Yeah.
It's being diverted. Let's call it stolen. It's because the formula's broken. So we need to, that's one of the things we really need to work on is, and it's a big political problem because who wants to go fight against these powerful hospitals? But they're taking this money, they're not giving the treatment to this population, and we're stuck holding the bags at all of our safety net hospitals.
It's not just, I think, the safety net hospitals. I mean, if you think about the HICRA dollars, it's Ashley's members who are paying for it. It's Becca's constituents who are adversely affected by it. I think certainly we would agree that there needs to be some meaningful change to the indigent care pool so that those dollars go to those institutions that do the bulk of the indigent care. So sort of picking up on sort of some of the issues that we talked about around immigration. I think that leads into the conversation that we had late morning about breaking the glass ceiling, diversity, equity, and inclusion. That talked about efforts to advance equity and inclusion. Becca, I'm going to start with you. Are there efforts, policy proposals that either the state or marketplace folks in the business sector ought to be thinking about as a way to sort of support greater advancement for women and individuals of color?
Yeah, I would say one main thing at the state level is really implementing a strong public financing system for elections, right? Like we have this in New York City, it has worked really well. New York State passed a public financing system, but now needs to really fully fund it and be able to implement it. And we see this as kind of the best way in our communities to make sure that working class people of color can actually run for office without having connections to wealth or without being kind of, without having the funding to be able to do it on their own, right? So it creates a system to allow people from communities who may not have access to be able to run for office and potentially win. And I think so part of our platform is really to ensure the state funds it with $70 million and actually implements it this year. And so I mentioned New York City just to say that New York City, it has worked in New York City. We saw this year kind of the slate of really of progressive kind of council members that took office, a really diverse group of folks who were able to do it because of public financing. So that's one thing. I think others, just to note, I mean, obviously, I'm talking about coverage for all a lot, but really thinking about equity and inclusion, like what more, that is a clear way to make sure that we are addressing equity issues within our healthcare system, right? These are folks who are just explicitly excluded from coverage and not able to access it, right? So how do we make sure that we create a more equitable healthcare system? And we're not doing it unless we're actually opening it up to include everyone, regardless of their immigration status. So I would say those are the two main things I mentioned there.
Others on the panel, thoughts about, ways that either, the state or, businesses, employers, others are thinking about, should be considering ways to advance equity, diversity either in the workforce or in other aspects?
I try to say this without being a hypocrite, but I represent 5 cities right now, probably one of the lowest income assembly districts in upstate New York for the most part. We have a dearth of healthcare providers, and there's a reason why. The Medicaid system puts a lot of pressure on the managed care plans and the fee-for-service. They don't want to pay for it. They're not able to. You know this, you guys know what you get per head. And it makes it difficult. I use the example all the time. I know it's pharmacy, but it makes a difference. 4 Walgreens from south end of Albany to Cohoes, within 8 miles, my 10-minute drive, got up and left. It wasn't because they made too much money, it's because it wasn't sustainable. And at the same token, we're wondering why in minority populations we have such unacceptably high diabetes rates, for example. So we got to find a way to right-size the system. We talked about the hospitals upstate, downstate. We got to try to find a way to make sure that these populations aren't being left behind. I spent a lot of time with the Black Nurses Coalition, and it's a mess over there in Arbor Hill. They're just not connected. Giving them a COVID shot was like the best thing that's ever happened to them in 20 years. And they're just disconnected, but quite frankly, they're going to show up like a train wreck at St. Peter's or Albany Med if we don't get them connected to the system. So we've got to, and I know that's going to take money. I know it's kind of talking out of both sides of our mouth, but that's what we do in the legislature.
Well, although, some of it might be we need to rethink how some of those dollars get allocated.
Yeah.
And certainly, I think there's funding that supplemental payments that go to certain institutions. Maybe if to Josh's point about rethinking the indigent care pool, if you're reallocating some of those dollars to go to the greatest need, maybe that addresses some of the issues that you raised.
The 1115 waiver is probably going to be approved sooner rather than later. There's going to be opportunities to build upon the value-based programs that could provide the necessary infrastructure. Got to be careful because everyone's probably already spent the money 3 times over, but the reality is there's opportunity to do things in the areas that have the greatest need.
And like you said, reallocating funds from the business perspective for diversity, equity, and inclusion. When you look at small businesses, look at how New York State spends its economic development dollars, right? We really love to have these big, flashy projects, and no offense to the Buffalo Bills fans in the room, but $600 million to the Buffalo Bills is a lot of money. Is there a way that we can use those economic development dollars to help MWBEs, to help small businesses that are just starting out, that are, people of color, that are women? Why should the Buffalo Bills get $600 million and you have a hardworking individual who is sort of pursuing the American dream of running their own company, running their own business, whether it's a restaurant or a bakery or whatever it may be? Why not have some sort of economic development assistance for them? And I think that's a major way that we can improve diversity, equity, inclusion, is rethinking how we spend our economic development dollars. Because sadly, entrepreneurship is declining in America. It has been for a long time. And we all know that entrepreneurship is one of the best ways to the middle class. So we need to bring that back and revive it.
Ashley, I think maybe about a year ago, the Albany Business Review had a piece about some of the challenges that minority and women-owned businesses have with the state process. Has it gotten any better? Are there ways to improve it? Is that something that's on NFIB's radar and agenda for next year?
Absolutely. It has not gotten any better, unfortunately. Some of that is a staffing issue, right? where they just don't have the resources to process the applications and paperwork that they need to. Some of it is an enforcement issue. We have members who are women-owned businesses, minority-owned businesses who have been for years and went to their recertification and were denied. And the appeals process is horrific. It takes forever. You know, they have to go before a judge. The courts are backlogged, and it takes 2 years, 3 years, and think of all those state contracts that they've lost out on. So the MWBE certification and recertification process desperately needs improvement, and there's more work to be done on that.
If I could just build on that, we actually just recently introduced a bill on that recertification process. And here in the Capital Region, we've had a couple tragic stories where businesses, where I know the owners, they are more than involved in their business, running it day to day, and they're being held up on the recertification, and they're losing contracts.
Yeah.
It's a shame. So we want to change the whole conversation to basically presume that unless, you know, you attest. I mean, as the providers, we have to attest every year that we do this, that, and everything. You as a business owner, you attest to the fact that nothing materially has changed. And then take that group that was not getting through the applications and get them out to the field and do inspections, because, yeah, there are some bad actors in the NWBE field. Not a lot, but there are some. Let's hold everybody accountable in that aspect, but let's not slow down the process, particularly now when we've got so many challenges going on.
So our previous panel talked about issues of universal coverage, different approaches to get there, pros and cons, single payer, public option, alternatives. I know we're going to get a couple of different perspectives on this panel, but over the last several years, the New York Health Act has certainly gotten more and more attention. There's been discussion about. For each of you, give me a sense of what impact creating a government-run system would mean for the constituents that you serve. Becca, I'll start with you. I have a pretty good sense of what your answer is going to be, though. So.
And I may have rocks thrown at me, but here we go. No, I mean, we fully support the New York Health Act. We see it as a way to revamp the system and create kind of a new equitable way to provide quality, affordable care to everyone. It's inclusive. It includes undocumented folks. It includes everyone. It kind of levels the playing field and creates a new system. I know it will take time and it's a lot of work, but we really see it as the solution to be able to kind of improve a lot of the problems that we've talked about today within our healthcare system. And we see it as kind of a much needed overhaul to the system. So, I think I say that, but I also say that on the way there, obviously things like coverage for all, dealing with medical debt are kind of things that need to happen immediately to resolve some of the immediate issues as we're kind of working towards the overhaul of the system at large.
Assembly member, you can pick which hat you want to wear. The pharmacist, assembly member.
So be steady here. So, the reality is the framework is already there in place to really expand coverage. We're at 95%. Granted, some people may not like their copay, they may not like their deductible. Room for improvement, as always. And listen, I love Dick Gottfried. You can't find two more different people than Dick Gottfried and myself. You can't. But I cringe when I hear everything should be free and no one should pay for it. And then at the same token, and Josh and I have had these discussions, although I will say I used to negotiate contracts with CSEA, and I never thought they were happy negotiating with me, to be honest with you. You said they were happy. I don't know if they're happy, but the truth of the matter is a lot of the labor groups are not supportive because, and I saw this myself, they gave up advancements in salaries to retain health benefits or to minimize the impact. So I think we've got a very big challenge with that. I think we also have a much larger challenge, which nobody really focuses on when it comes to healthcare, whether it's long-term care, whether it's plain old healthcare, whatever it may be. The federal government's got to be in on this. And when I look at the National Council of State Legislators map, and it's either going to be blue or red, there's a lot of red all over that map. That's not going to happen at the federal level. It's just not. So we have to think more incrementally. We have to look at, okay, what populations are not being covered that it's in all of our best interests to expand that coverage, and what ways can we bite it down? And then we start moving on the edges. We got coverage for those up to 26. We've got basically 65, move it down to 60. Do something in that area, and when all else fails, the state can make their own decision. What income threshold do we want to support? Do we want to raise it? do we not want to raise it? Maybe that's a way to get that 95% to 97.5%.
Ashley?
NFIB overwhelmingly opposes the New York Health Act. We surveyed our members on it. They shudder at the idea of a government-run system and the price tag associated with it. The New York Health Act would require up to $250 billion in new taxes, predominantly paid by businesses. And to our conversation earlier, if you're a small business owner and right now you have that flexibility to make adjustments to your overhead healthcare expenses, going to a single-payer government-run system, the tax is the tax, and the government gets to set it. And it doesn't matter who you are, you're going to have to pay that. And that's very, very difficult for businesses. And they certainly have lost trust, no offense to the Assemblyman, in government. And you can look at the comptroller's report just a couple days ago on the fraud that happened in New York State's unemployment insurance system, $11 billion in fraudulent payments that went out, and small businesses are on the hook to make those payments back. And so there is a lack of trust that the government is going to be a good fiduciary and be responsible for carrying out such a program in a way that protects those taxpayer dollars. And it's certainly going to cost small businesses substantial amount of money.
Josh?
So, Assemblyman McDonald's right. CSEA is firmly opposed, but it's not just CSEA. It is not every labor union, but I would say the vast majority across the state are opposed to the New York Health Act. I want to say CSEA is probably the loudest of those unions out there in opposing it. And it comes from a few places. One, so we have 1,200 different collective bargaining agreements across New York State just for CSEA. And each of those have, health cost sharing arrangements and as well as wages. And people have made decisions, and our leaders have made decisions very locally over the years, to give up a raise, as you said, in order to keep health insurance, the cost very low. We still have local governments in New York State where our members pay near zero, but they also make very little money compared to the private sector. Mm-hmm. They have made that trade-off, and the New York Health Act doesn't say anything to that. It doesn't address that issue. And in fact, right inside the current framework of the New York Health Act, everybody would pay the same percentage, including, so if you're a CSEA member who pays zero right now, you are getting a tax increase on day one. You are all of a sudden going to start paying 20% of whatever that premium is for your health insurance. And so that's a major problem if that's the arrangement you set up. But I think the second issue is, the cost, $250 billion. They say it's going to be in new taxes. But at some point, they are going to have to raise money from somewhere else to pay for these. As we know, medical care gets more expensive.
Right.
Where are they going to cut? They're going to have to cut something in the future. What service are they going to cut? What program are they going to cut in order to backfill that? Or they cut health care, which is what they're promising they won't do, right? You have every service under the sun, and we just don't trust them.
Which is what we heard from our previous panel. So, go ahead.
Let me just, two of them, we don't trust them. That's okay. Sometimes I feel the same way. But, I just want to mention two things. First of all, I've always been amazed when providers come in and say, we need to have single payer. I said, oh, you really love dealing with Medicaid that much? Well, what do you mean? I said, well, that's what it's going to be. I said, you're realizing that government will wake up some point and say, oh my God, we're in a recession, we got to make cuts. And that's where I think we need to be very thoughtful about. The other challenge, and it's relevant to your first question or second question today, my staff keeps track of who's coming and going in the assembly. We are losing 30 members out of 150. The Senate's losing about 18 out of 63. There is no institutional memory. We can't even get people to stay there long enough to have a discussion about term limits because they go before we'd even get to the barometer of term limits. And I say that because institutional knowledge and memory is important in regards to understanding why things are like this today, because they were here before, here's where they are, but there was sacrifice and change, and I don't think that, and I'm not that old, but I think some of the younger folks don't understand that some days. And I think it's important because people do make differences and challenges and sacrifices, and it gets lost sometimes.
So we're almost at time. I'm going to leave with one question for each of you. It's sort of a two-parter. I'll give you a chance, to see you can decide whether to answer both or one. So earlier today, Katie Martin from the Healthcare Cost Institute talked about, what's the one thing that we could do around healthcare. And so when we talk about, as the Assembly member mentioned earlier, we're below 5% of uninsured in this state. So to wrap it up, give me the one thing that the state should do either to expand, reduce the number of uninsured, make healthcare more affordable, or both. And Becca, I'll start with you.
Great. I mean, I would say the number one for us would be coverage for all, right? Including everyone in insurance regardless of immigration status. So creating a state-funded essential plan or some program to be able to ensure that undocumented immigrants are eligible for insurance in New York State. I think this, can I add a second thing?
Sure.
The second thing would be, which I mentioned earlier, which is making sure that there's funding for community-based organizations to do outreach and education for those who are eligible but not enrolled, right? To make sure we are really targeting those communities who aren't aware that they're eligible or who may think that they're not, who may think that they're not eligible but are, who may have no idea, or who just are skeptical, scared of the government for whatever reason, right? Not sure if they should enroll or not, right? Making sure that we are providing targeted outreach to those communities to enroll them in coverage. So I'd say those are our top two things.
So I agree with that, so I get two more things.
Okay.
I think we need to invest in our workforce. This past summer, the governor announced and awarded $15 million for Nurses for a Future scholarship. Great idea. Restricted to the CUNY and SUNY schools. Why aren't we doing it with all the private colleges with proper restrictions so they take advantage of it? Because that nursing shortage is bad now. It's about 6,800 statewide. It's going to be 30,000 by 2030. And it gets back to the challenges we're seeing with the pressures going up in the hospitals and nursing homes. So I think that workforce pipeline we really have to invest in, whether it's charter nursing schools, which we're looking to do here in the capital region. I know sometimes that gets people angry, but that and really providing more workforce challenges and expanding coverage.
Ashley?
Yeah, I think, certainly expanding coverage, addressing that 5% that's uninsured is important, as everyone's talked about, for a variety of reasons. But, we talk about funding, and we're in for some tough budget times ahead. So we have to be careful on the funding front. And you brought up the HCRA taxes before. I mean, that's part of the reason why health insurance premiums are so high in New York, is because employers are paying taxes on health insurance. So the funding, it's got to come from somewhere. New York State, I think, has to take a really hard look at its Medicaid program and other programs at the state level and find the funding to make these things happen. The solution, I don't think, can be to tax or just spend more, because we are in for a rough budget road. So I will echo some of the other sentiments, but we need to be very cognizant of what we're spending and where we're spending it.
Josh?
So I think achieving near universal coverage is number one, and I think that could be done. The outreach, I think, is really important. We know that there are probably hundreds of thousands of people that are eligible for something. We just have to reach them. Is it Medicaid? Is it CHIP? What is it? And then we know there's people that are eligible for marketplace subsidies. How do we get to them? We also need to acknowledge that some people just never sign up for insurance. We just know that is a fact. We need to acknowledge that. So that's number one. And number two, I think, is we really need to look at price transparency. Even within our union, we've moved, some of our locals and our contracts are moving towards high deductible plans. But if you want to have a cost-conscious consumer, if you want a consumer that's driving, the bus, they need to know what something costs. And until they can make that educated decision, they're going to just keep going where they always go, and that may not be the most optimal place.
Well, please join me in thanking our panel. Thank you all again for being part of this. Becca, Assemblyman McDonald, Ashley, Josh, That'll do it. That's a wrap. So thank you all for joining us. I want to thank again the HPA staff for their hard work on this year's conference, as well as the work that they do every day on behalf of the industry. I want to thank Danielle, our new intern. This was your first day. Hopefully you had a good first day. I want to just acknowledge, I hope everybody has a great holiday season. Thanksgiving is next week. Please make sure, if you haven't already, so we're picking up on the Assemblyman's point, get your COVID vaccine, get boosted, and get your flu vaccine. And with that, thank you all again. Don't forget, there is the evaluation and the microsite. If you could give us any feedback on this year's conference, it always helps us for next year. So thank you, everybody.